Well, I think our live stream is going to start here shortly, if not already. So we'll get ready to kick things off here in another minute or so. And my clock says 1:15. So let's get started today. Let me welcome everybody. I'm Kirk White, filling in for Chuck Carney today. It's been a busy news day at Indiana University, and we're quite excited to welcome our President-elect Pamela Whitten, who will be joining the university as of July 1st. The Board of Trustees approved that by vote this morning, and so we look forward to welcoming her to the campus and to the university community here in Bloomington and around the state. I serve as Assistant Vice President here at IU and co-lead of our COVID response unit for the Bloomington campus. And today, welcoming you to this news conference for an opportunity for our community leaders to share the most recent development in our coordinated efforts to battle the COVID pandemic and allow our media representatives to ask questions and get up to speed on the latest developments. Joining us today on behalf of Mayor John Hamilton is Mary Catherine Carmichael, Director of Engagement for the City of Bloomington, and Monroe County Commissioners President Julie Thomas, IU Health South Central Region President Brian Shockney, Monroe County Health Department Administrator Penny Caudill, and Monroe County Emergency Management Director Allison Moore. And so today, let's get started with our update from the city. And Mary Catherine, we'll turn it over to you.
Thank you very much, Kirk. It's nice to see you. Nice to see everybody. Thank you for joining us. You've stuck with us for a long time on these press conferences, so thank you for everybody who shows up week after week. We appreciate it. Not a whole lot to report from the city today. I will tell you that we are hearing from folks some concerns about the confusion between the governor's orders and our local orders. You may or may not be aware that the governor recently made it no longer mandatory to wear a mask in Indiana. That having been said, the Board of Health here in Monroe County and certainly within the city of Bloomington, we've decided that, hey, you know what? The approach that we've been taking over time has been working beautifully. We're going to stick with this. We know we're not out of the woods. So for those of us in Monroe County, let's continue to wear those masks. We know it's kind of confusing. So to that end, the city of Bloomington is deploying some message boards, kind of in some critical arteries inside town to remind people that, hey, here in Monroe County, we're still wearing those masks. We're still taking care of each other in that way and protecting ourselves and each other and those folks who are visiting. So we do anticipate, especially at this time of year when the weather is so beautiful, and what's more beautiful than a town named Bloomington at this time of year, right? So we got a lot of people here who want to take advantage of our beauty, and we love that. But we do need to remind some of our neighbors who may be visiting that, hey, here in Monroe County, we still mask up. Along those same lines, we've heard from some businesses locally who are concerned that their employees, some of whom may be servers in the local restaurants and night spots, that they're being put in the position of kind of having to serve as the masked police. And we don't think that's appropriate. They don't like it, obviously. These are businesses that have signage on the doors letting folks know, hey, if you want to come in and do business here, you will be expected to wear a mask. And so we just ask everybody to please mind those rules, continue to wear those masks, and don't put those employees, some of these folks are, some people are professional servers, some people, work in these stores all the time. Some are just college students trying to earn enough money to stay in school. So please don't put them in that awkward and inappropriate position of having to be the police people around masking. So we really appreciate your cooperation there. And I know that the folks you interact with who work at these businesses really appreciate that too. Finally, I'll just say that we did have one additional positive case of COVID reported among our city of Bloomington employees this past week. That brings our total to 78 out of around 850 employees, and that's for the duration of the pandemic. We're happy to report so far everybody has recovered nicely, and we're so very grateful for that. We don't anticipate this will be a source of spread. This was an employee who did not have close contacts with other folks during their infection, so we anticipate this will go well. And we just continue to urge people to do all the things we've been talking about for a year, especially masking and distancing and washing their hands. So thank you very much. And if anybody has questions, I'll be happy to answer those at the appropriate time.
Well, thank you, Mary Catherine. You know, I just came in from walking down Kirkwood, and boy, lots of people taking advantage of the open air restaurant seating along Kirkwood. It's a great day in Bloomington, and we want to encourage people to continue to do that in a safe way, just as you've outlined. It's a great opportunity to dine outdoors and at a safe distance.
Thank you.
Well, now let's move over to Penny Caudill, the director of the Monroe County Health Department.
Great. Good afternoon. Thank you, everybody, and thank you, Mary Catherine, for those words. We agree with that completely. You know, if we will all just obey the regulations, then we can, you know, not put anyone in an awkward position of having to ask you to put your mask on. You know, just please follow the regulations. We appreciate you helping us with getting those signs out in the community as well. Very, very grateful for that. I think for us, the big topic today is probably the vaccine and kind of where we are with that. Johnson & Johnson was kind of put on hold this week and for the Advisory Committee on Immunization Practices and the CDC to review some adverse reactions that had been reported. And what this really means, number one, is that the systems in place that monitor reactions to vaccines is working. So there is a system, the Vaccine Adverse Event Reporting System, that we ask everybody to kind of sign up for when you get your vaccine and report any conditions. So that is working. There's been 6 reported cases out of almost 7 million or more than 7 million vaccines of the J&J that have been distributed. So an extremely small number. But they were kind of watching for this, and that system kind of pinged these for them to look more closely at. There's blood clot issues, and so they're investigating those right now. They do expect to have recommendations by the end of next week. So J&J is just on pause for the moment. If you have received that vaccine and you're concerned, you really just remain calm. Watch for any symptoms, and really we're looking at headache, abdominal pain, shortness of breath, leg pain or swelling. If you were to notice that, when these adverse reactions have occurred, they've been in women between the ages of 18 and 48, and they've typically occurred between 16 and 13 days after getting that vaccination. So with that pause, there's still a number of people who may be within that 2-week period. Just monitor for those symptoms. If you think that you have any of them, contact your provider, visit the emergency room if that seems the appropriate action at that moment as well, and that can be evaluated. So we are pausing. For us, we did not have any large-scale vaccination clinics planned with Johnson & Johnson yet, and so we just had to do more of a small pivot. We were using Johnson & Johnson for some of our outreach programs, and those are now being used with Moderna. That is happening all around the state and all around the country. The Indianapolis Motor Speedway Clinic has switched to Moderna as well. And we just got an announcement from the state that this weekend an appointment will not be needed at the Motor Speedway. So you can go there, get Moderna vaccine, and get started on your vaccination if you have not. So again, the system is working. This isn't a time that we need to do anything but remain calm and observant, and should have more information on this by the end of next week. In terms of Indiana and our vaccinations, Indiana reached more than 1.5 million Hoosiers are now fully vaccinated for COVID-19. And so we are well on our way to getting where we want to be, which is at least 75% of our population fully vaccinated. In Monroe County, of those who are eligible to be vaccinated, we have about 24.5% of those eligible have now been fully vaccinated. So we are doing a good job of vaccinating our community. And that is thanks to everybody here, the university for joining us in vaccinating our public and for them vaccinating students, for the hospital starting us off with vaccinations in December. All of those efforts locally and across the state are making a difference. So we want to encourage everyone to still consider being vaccinated. It truly is our way out of this, as well as continuing to mask, maintain distance until we get to a point where we have enough people vaccinated that we are really not seeing any community spread. And when I speak about community spread, I also have to talk a little bit about the variants. The B.1.1.7, the UK variant, is now the most common variant we're seeing in the United States and in Indiana. The California variant is what we're seeing second most often. And the state's dashboard is now kind of tracking. There's the vaccine tracker tracks some of those variants and the percentage that's sequenced, so we can kind of see what's going on with those variants. It is more transmissible. So again, that's the reason that we need to continue to wear our masks at the moment while we're still getting people vaccinated, even if we may have been vaccinated. If you have been fully vaccinated and you are visiting in your home with someone else who's fully vaccinated, you can be a little more relaxed than you were 4 or 5 months ago. But when you are out in public, we still need you to be following these precautions for the good of everyone. We do remain in yellow in terms of an advisory this week. And you know, the difference a few days can make, because I looked at the numbers, kind of anticipating where we might be, and said, you know, we're probably going to be about 135 cases per 100,000. We came in, I think, at 147. So that was an increase that I kind of wasn't quite expecting. But again, we're hoping that we're seeing the end of that kind of spring break travel and those infections, and those numbers will start to come down. They certainly can come down if we continue to vaccinate and follow precautions. We are, and I know the hospital will talk about hospitalizations and what we're seeing there. We will continue to make decisions based on the information and the science that we have, not on feelings. We all, if it were based on feelings, we would all just say, we're done, right? Everybody is tired of having to deal with COVID-19. So hang in there with us. We want to get through this as quickly as you do. And the way out of that is to be vaccinated at your first opportunity with the vaccine that's available to you, and to continue to wear masks, socially distance, wash your hands, get tested if you're symptomatic or you think you may have been exposed. Follow all of those regulations and precautions, and we will certainly get through this together. And I will take questions when you are ready for that.
Thank you, Penny. And now let's turn to the county government and President of County Commissioners, Julie Thomas.
Thank you so much, Kirk, and thank you for filling in so ably this week. We appreciate you. Just a couple of quick notes with our funding that the Board of Commissioners and County Council are providing for people and businesses in our community. Our last round of CARES funding, and these are grants, not loans, will be closing at the end of April. So please go to co.monroe.in.us if your business or social service organization needs COVID-related assistance, non-payroll. We will be very happy to review your claim, but please do so soon. We want to close this out at the end of April, and hopefully that is when the federal government will be stepping in more fully. So this should be seamless, we hope. But to date, we have provided direct CARES funding in the total of $881,265. And that's to ensure that we have a vital community and economy when we emerge, as soon as we emerge from COVID. Also of note, for residents who have faced job loss or reduced hours as a result of COVID, that we have worked with the council to provide township assistance funding. So if you need assistance with things like rent or utilities or basic necessities, please contact your township trustee. They have funding available to help you to ensure that you can maintain your residence and your utilities. To date, we have provided $80,683 in grant funding, just direct funds, not loans, to 148 households in Monroe County. And we're really proud of that and grateful for the work of each and every township trustee. And anywhere you live in Monroe County, you live in a township. So you can go to co.monroe.in.us and you can find that contact list at the emergency management page. So thanks again to the County Council for helping to make this happen. We're also continuing to utilize the private security company to provide mask education and assistance both within the city and in the county as well. Please continue to wear your masks. We appreciate those who do. Please continue your social distancing and hand washing practices. They've worked so far for the most part, and that seems to be our way out of this as we get our population vaccinated. So grateful to everyone at the convention center for their assistance and all the work being done between IU, the hospital, and our convention center and our health department at the convention center to help ensure that we get as many people vaccinated as quickly as possible in our community. That's our way out of it. And we're all doing a lot to get us there. So we'll take questions at the end. Thank you so much.
Well, thank you, Commissioner Thomas. And now let's turn to Brian Shockney, President of IU Health South Central Region.
Thank you, Kirk, for leading today. We appreciate that. And for all of those who join us, I would like to give our heartfelt sympathy to those families and individuals affected by the mass shooting this morning. And just a shout out to our first responders and our healthcare heroes who responded in that situation. Our numbers of IU Health COVID-19 patients have remained fairly level from the increase we saw last week across the IU Health South Central region. Here in Monroe County, though, we've at IU Health in Monroe, we've shown this increase as you see on the slide. While we usually show our numbers over the past 13 months, it's important we focus on the last 60 days to help us understand the current increase we are seeing in our trends. Last week, I mentioned concern over a trend in the younger COVID cases that we were seeing, which this speaks to the effectiveness of the vaccine for those older adults who have received it, as well as those who need to still get the younger population vaccinated. So as you see on the screen, to further highlight that point, I wanted to share this additional data which shows the trends of inpatients. These are our very sickest patients by age of COVID-19 testing, by age across the IU Health system. As you can see, our younger populations continue to increase while our older adults are declining. I've mentioned several times over the last month continued concerns around case increases within our bordering state of Michigan. And I also wanted to highlight how concerning their surge has been over the last month. As you can see on the screen, a comparison of average daily cases by county for the state of Michigan from the middle of March to now. That's just 1 month. You can see the troubling increases of cases across that state. And here in Indiana, we have seen a similar trend of increased cases. We are hopeful, though, that continued policies in counties like Monroe and Marion, access to vaccine and safety protocols are going to allow us to ensure we don't enter into a surge. While it feels like COVID may be behind us in many ways, it's not. And the state of Michigan is just one example of an alarming reminder that COVID is still here and it's very real. The best way that you can choose to help ensure our communities don't see another surge is to make the choice to get your vaccine. We're incredibly grateful for the 71,021 individuals as of last night from the counties in our South Central region who have made the decision to get vaccinated at our Bloomington and Paoli sites. And we were happy to celebrate our 70,000th shot this week. Our vaccine supply in Bloomington continues to be in great shape as we've utilized 52,204 of the 55,530 vaccines we've received. That is a 94% utilization percentage. As a healthcare provider, it's also our priority to ensure our patients and communities feel safe and have assurance in their healthcare decisions. So I want to take a moment to share what our local response has been and our IU Health response has been to the J&J vaccine pause. IU Health has pulled all J&J from our vaccine sites at this time, and any scheduled appointments have been transitioned to either Moderna or Pfizer. We are reaching out to the high-risk clients, those females 18 to 48 who received this small number of J&J vaccines from us, and to the leaders of the organizations where the vaccines were given to remind them of the symptoms to watch out for and contact their healthcare provider if needed. The quick reaction of the CDC and FDA to temporarily pause this administration of the J&J vaccine speaks to our federal agency's focus on safety of the vaccine. This should provide assurance to all of us that effects are closely monitored and the vaccine remains a very safe decision. So we hope you will join us in continuing to make the right choice and get your shot. I will take questions at the end.
And thank you, Brian. And I noticed in our translation at the bottom, it mentions that we transferred J&J to Madonna, and that's probably not true. It really is Moderna. So just in case anybody was confused, it's really Moderna. All right. Well, now let's hear a report from our County Emergency Management Department and Allison Moore, the director.
Thanks, Kirk. I love when we first switched to the dialogue at the bottom. That was the first thing that chuckled me was that Madonna. It has done that this whole time. So funny, I guess, little funny humor to it. We have 2 blood drives scheduled in April that we still have several spots open for, and they are the 29th and the 30th. And because we have so many spots open, the Red Cross is offering a little incentive. If you're in the ages of 16 to 24 and you make a blood donation to either one of those drives at the convention center, then you can get an electronic gift card for a food industry in the community. They'll have several different food options for you to select, and you can make that donation and receive that $10 card. So if you have a high school student or a young adult, or if you are one of those individuals and you hear this message today, or you're not, and you know someone, we encourage you to spread that word and have them go to the redcross.org website and make such appointment. We have additional appointments now scheduled through August, and they are on our county website. And so we encourage you to go to the co.monroe.in.us website and click on the emergency management page, and you can find those dates. And so if April doesn't work for you, find one that does, and then hop over to the redcross.org website to make your appointment. While you're on the county website, if you've not signed up for the Monroe County Alert, then we encourage you to be able to hop on by clicking on the megaphone and sign up for our alert messages, which will let the public know when different age brackets are available and different sectors in general that might qualify for that vaccine, and any information about that, as well as weather alerts. And so we continue to try to get those words out. Our office continues to work with those public safety providers, making sure that they all have PPE, and that way we can continue through this, even all this time later, to serve our public in whatever capacity or needs that the county might need. And that's all I have, Kirk. Thank you so much.
Well, thank you, Allison. And from the university, let me report this week that at our vaccination site, we were able to, we're up to a total of 11,306 vaccinations in the past 3 weeks of operation since we began on March 29th. 3,421 of those are at our open pod site, and 7,885 are at our point of distribution that's focused on students, but lesser to faculty and staff because they're eligible for the open side as well. So that 11,000 number is great for us. Next week at our open site, we expect to have 3,120 open appointments, or we will fill 3,120 appointments, and that will continue to increase in the coming weeks. We expect an upward trend to get us up to 3,900 and then perhaps 4,700 the week after that. So as long as supply keeps coming in, the state's going to continue to give us those appointment slots, and you can continue to sign up at ourshot.in.gov for that open point of distribution. And as was mentioned just before we started, it was announced, if you looked at the state statistics, Monroe County had the highest per capita first dose administered in the state on Wednesday. That's a great milestone to be able to talk about. And so we think that the efforts of all of these clinics going on helped us get to that point. In particular, the interest we had from our students who came out in thousands to get vaccinated. Now, as I switch over to the university's report on mitigation testing, for this last week that we reported, we tested over 20,068 students, faculty, and staff. The prevalence rate remained about the same from last week to this week at 0.4. And so far this week, as of yesterday, we had tested 13,050 students, faculty, and staff. So we're continuing to trend about the same in mitigation and symptomatic positive rates, and we're continuing the same pace of mitigation testing, and that will continue on through the next couple of weeks as we get toward the end of the semester. Now, I just want to remind everybody that the cases, the number of cases, the positivity rates, hospitalizations, and deaths are all rising in Indiana, as we've talked about before here today. And we've got to remember that only that yet we have 77% of Hoosiers that are yet to be vaccinated. So that's still a big number when you think about the number of people who are vaccinated as opposed to who aren't. We've still got a long way to go, and so lots of work to do. So with that report, let's get to questions today, and we'll get started up here. Look like Dave Askins from the B-Square Beacon has a question for Mary Catherine. When you said message boards along key arteries, do you mean those actual billboards? He wants to take a look at one, and where are they placed?
Thanks for that. Appreciate it, Dave. So we're trying to identify today, in fact, just how many of those signboards we have. And what we're referring to are the electronic signboards that have the changeable messaging. You would have seen them deployed on campus for this kind of use already. When we kind of identified campus as being a key area that we wanted to, at that time, we were reminding people about the gathering size that was set at 15 in the city of Bloomington for private gatherings. And so we deployed these signboards around there. You often see them being used to let you know that a road is closed, that sort of thing. But we're changing the messaging a little bit on these to remind folks to wear their masks. So I know there's planned to be one on Kirkwood, one on College. It kind of depends on how many we can round up. It is construction season, so they're pretty popular for use to keep people safe around construction zones. But we're going to grab onto all we can, and everything that's not being used to keep folks safe elsewhere, we'll deploy around the downtown area.
And our next question is for Penny Caudle from Dave Askins, and he's asking about the goal to have 75% of the population vaccinated. And for measuring progress to date, he said you said 24% of those eligible have been vaccinated so far. Is the goal also defined only in terms of those who are eligible?
I think it's probably a variety of things. So, there's multiple goals, right? And initially, right now, we have a certain population who is eligible. We want at least 75 to 80% of them to be vaccinated. We know that Pfizer has put in for an amendment to their emergency use authorization to add 12 to 15-year-olds to the age groups that are eligible for vaccine, and that will expand that. And that will continue to expand. But when we look at, in terms of sort of that herd immunity, that we're going to need at least 75 to 80% of our population vaccinated, plus then you add in those who may have recovered from and have some immunity. The thing is that we know more about and will know more about the immunity from the vaccine than from those necessarily who have recovered. So the more people, we've talked about this before, what I really want is, anybody who's eligible to be vaccinated, I really want 100% of those people to be vaccinated. That's what I want. But you have to kind of set your goals somewhere. And even when we look at normal vaccine numbers, if you reach 90%, that's phenomenal. So getting to 75%, when we get there, you're going to hear me push to get a higher number. I'll just warn you about that right now. That's my current goal.
All right, and then Ethan Burks from WFIU TIU has a question from Penny, Mary Catherine, and Julie. He mentions it's still early, but President Whitten's introduction today related to that, and how will both the city and county coordinate with the new administration at IU on how to move forward with local pandemic efforts? What discussions will be most important to address? Is it vaccine requirements for students, increasing capacity at Assembly Hall at our vaccination site? And what will the timeline for these discussions look like? And then for Mary Catherine, do you expect the mayor to have a sit down, perhaps these days even virtual, with President-elect Whitten? So Penny, do you want to start with that?
Certainly, we have a variety of contacts that we use, starting with Kirk White, who's right here with us, and we will continue to use all of those connections and resources to figure out the best timing of that. Our relationship is good, has been good, and I have no doubt will continue to be good. And as the new president comes in and gets situated and settled, we will just kind of fall in line with those processes, and I anticipate things will be a smooth transition.
And Commissioner Thomas.
Yeah, Penny is spot on. We have had such an amazing relationship in this community between the hospital health service system, IU, city, county. We have worked together so well, and I think that I don't anticipate that to change at all, and we'll do everything we can to continue to foster the great communication and the collaboration that's gotten us where we are now, which is in really pretty good shape considering.
And Mary Catherine, I know the mayor will be reaching out, I'm sure, and there's a list of new people to meet that President-elect Whitten is making as well.
Well, absolutely. And I want to build on what Julie said just a little bit. First of all, I know Mayor Hamilton is absolutely going to want to roll out the welcome mat to the city of Bloomington. This is an exciting time. So much of the history of Indiana University is the history of Bloomington, and we're so grateful for that connection. As one succeeds, does the other. I can tell you that having been in a variety of positions, having an opportunity to work both at Indiana University and various organizations in Bloomington, I've never seen town-gown relations stronger than they've been. Kirk, you and I have worked together for many years on these kinds of projects too. Excellent relationship, and we're going to continue to build on that. Of course, you know, there are upper-level management groups a group that meets on a regular basis. That group will be having another meeting very soon. And we so value this close relationship with Indiana University. And of course, in this crisis that we've been in the last year, bringing in the hospital and the county as part of that team as well, just, I can't tell you how valuable that's been. And based on my information I get from other communities, fairly rare. So truly a great thing that's been happening here in Bloomington and Monroe County and on the campus of Indiana University. And I think it's fair to say that none of us could have done this without the other. It's been a multi, each leg of that needed to be there to support the other. So we're very grateful for that. I hope that answers the question.
Yeah, Mary Catherine, I'd echo that. I've worked in this arena for 36 years at the university, and I've never seen the level of joint operations and cooperation. Unfortunately, these kinds of things do bring you together. It's an unfortunate situation, but the good side is that we are working as well as we could possibly work together, I think. And it's that's the kind of thing that's helped us get through this. All right, so the next question from Dave Askins at the B Square Beacon is for Penny and Brian Shockney. It looks like the Tuesday numbers for J&J vaccine are close to zero. That seems to speak to the effectiveness of the communications from the state health department to the local clinics about suspending use of the J&J. When did you receive the notification? Was that communication done through normal channels, or was there an extra text message alert or something, a subject line perhaps marked urgent? How did that come to you from the State Department of Health?
Well, I'm not at my computer, so I can't pull up like the email to tell you what the subject line was, but I will tell you that it was immediate. We got information from different contacts that we have at the state that there was a pause, and we immediately switched to Moderna and contacted the people who had appointments that were going to get Johnson & Johnson, and let them know that they were going to be getting Moderna instead. So it was very swift and fast, and through a variety of sources to make sure that we got that information.
I will say, IU Health's relationship with the state, we've been working very closely on this whole vaccination, the mass vaccinations, and our team and our School of Medicine researchers have been connected. So that was a right spot on very soon. We were also notified through the pharmacy contacts. So all pharmacies were notified immediately through a mass notification. And then we all participate in many listservs and email connections that come out through the CDC and directly with the State Department of Health. So there were numerous ways that we were notified. And I would say all of us were notified by someone within 5 minutes of the announcement or less. And then we were able to pivot. And, from a numbers wise in Monroe County, the number of people who have received the J&J vaccine are very low. IU Health has only given 70 of our 71,000 doses have been J&J. So we've really focused our efforts on those vaccines that are dual with our scheduling and take two vaccines. So very low numbers that have been given in our community. But we did have plans for some additional one-time vaccine outreach, and we've moved those to our different vaccine brands instead of J&J for the time being.
Sure. And so then Dave also has a question for Commissioner Thomas and Administrator Caudill. Mary Catherine mentioned that retail employees are not the mask police, but the closest thing we have is the county's contract with Security Pro, which handles enforcement. Can you remind us of when that contract ends, and what are you hearing from those Security Pro contractors about pushback from people who don't want to wear masks based on this the difference because of the elimination of the governor's order, but yet we still have it here in the county?
Oh, go ahead.
You may go first. That's fine.
Okay, I can do the first part of the question if Ms. Cottle will take the second. Thank you. So we the Board of Commissioners at our April 7th meeting ratified in a contract extension through July 1st of this year.
And the first thing that I would say is we don't have any mask police in the county. You know, we do have law enforcement who can enforce the ordinance and the regulations that is in the regulation. We can write fines. Our compliance officers with Security Pro can write fines. That is not ever our goal. But it is the responsibility of a business owner to make sure that people within their business are following the regulations, as are their staff. And, you know, as was commented, we don't want anybody to be in that difficult position. It's not part of their normal routine. So if we can obey those signs that say, you need to wear a mask in here, that is the best thing that you can do. And if you're going into a business, then clearly you're going in there because you want to support that business. And the best way that you can support them is to help them stay compliant and with these regulations so that they aren't fined for non-compliance, for example. We have had issues all along. You know, there's always people who have complied and people who have not wanted to comply. We've had reports from businesses throughout the year that we've had this in place that, you know, some people really kind of want to argue that point. But what we really try to do, what our staff does, what the compliance officers do, is try to work with those businesses to use the skills they already have to gain compliance. That we've made masks available for people. So if it's it looks like you forgot your mask, do you need one? We can give one to you. Trying to work with individuals as opposed to trying to be heavy-handed. And you've heard me say this before too, while we may be able to issue a fine does not necessarily automatically result in compliance. And what we want is compliance. And so it is just really an ask that we continue to follow the regulations that are in place. As Mary Catherine mentioned before, it can be confusing when the state, you know, regulations are kind of non-existent now, and 10 counties have maintained some sort of mask regulation, but it varies even among those 10 counties. It is confusing to people. So I would say pay attention, understand that if somebody comes into your business, they may be unaware. So easy enough to say, oh, did you not know that we have this regulation? And for individuals, pay attention to the signs and the ask and follow those signs and recommendations that are posted.
Do you mind if I make just a quick comment on this topic?
Yeah.
Thank you. There's a very good article today written by Dr. Richard Feldman. He's the former Indiana State Health Commissioner in today's Herald Times. If you haven't read that, I really recommend that you do read that. And it talks about specifically this mask wearing, but it relies on personal responsibility. And so everybody has to cooperate and do this mask wearing for the greater good. Now, relying on personal responsibility, not always considered best practice in a public health setting. Usually we have rules and regulations. Penny knows this better than I. She's a public health professional, and I'm certainly not. However, this is really kind of handing it back to the public and saying, look, if this is going to work, it's going to work because you make it work. We're not going to be the ones forcing you. We aren't going to be developing a mask police. This is on you. So I really challenge everybody out there to take that personal responsibility and take that charge that we've been given and take it seriously. And you know, as Penny said, if you see somebody, go ahead and say something. You don't have to be mean or unpleasant about it, but just say, hey, just so you know, here in this community, we have a mask mandate. Please mask up. And I'm sure they're available at just about every storefront.
Thank you, Mary Catherine. And Dave has one more question for Penny, just to remind us of when the convention center operation will wind down.
Well, it is winding down. We are doing primarily second doses. We did add a day. We got some additional vaccines, so we added a vaccine clinic. Yeah, this is Wednesday, and that filled up very quickly. So that will extend our time at the convention center because we are doing all second doses there as well. So we will have some presence at the convention center now into May. There's a possibility we may end up adding another clinic or something there as well. So we are winding that down, but it is extended now simply by second doses into May.
And I guess, Penny, most of the intent is to move most of that to Simon Scott Assembly Hall, which
Yes.
we've already headed down that road and I see some good public acceptance of that, which is great. And so David Wolf-Bender from the IDS has a question as well about that goal of 75% to get the community vaccinated. And when you say that's the goal, do you mean that's the point at which the county is likely to drop social distancing and mask mandates? And how long does the health department think it'll take to reach that goal?
Well, I'm going to start with how long it will take us to reach that goal will really depend on every individual who's eligible getting an appointment. And we believe that vaccine will continue to come to us as long as we're being able to fill those appointments and get those shots out. So that's the first thing. In terms of the regulations, it is and always has been a variety of things. So 75% people vaccinated alone will not change things, nor will less than 75% of people vaccinated. It is what's our positivity rate, what's going on at the hospital, what's our cases per 100,000, what else is going on in the state. It is all of that information together. And even what's that cooperation? We've talked a lot about cooperation with masks. Do we need it? Or will people do it on their own and we don't need to mandate it? Wouldn't that be a wonderful thing? So lots of pieces to that answer. There is no one number or metric that will make us change those.
Yeah, Penny, I sure understand that. And that's kind of the way we're looking at it in terms of university events as well. It's a big picture with many different metrics to make sure that we maintain that safety level that you mentioned. And so Brian Ladwig from the HT has a question as well about what share of the local infections are occurring for people in people under 30, and how's that changed in the past few weeks? And Brian, you may have some statistics on that as well, but Penny, would you like to start? Do you have anything in particular there that you know?
Well, we are still seeing most of our infections are in that kind of 20 to 30-year-old range, but they go through every age group. The older individuals 60 and over that were vaccinated first, and we have as a state, I think 64% of everybody 80 and over has been vaccinated. So we're seeing fewer cases in those older age groups. I think fewer hospitalizations. Certainly more of our infections are in the younger population, but I think Brian can probably address that in terms of hospitalizations, which I think is really the very important piece, because people often think that I'm younger and healthier and I don't have to worry about getting infected.
Yeah, so here with IU Health, across IU Health, just between January 21st, the 40 and under population tested was about just below 50%. Now on April 21st, through April, the 16th, we are over 50% of the testing is in that under 40 age group. Then as we look at hospitalizations in January, we had just over 13% who were inpatients with COVID, required inpatient stay. Here in April, so far, it is approaching very quickly 30% under 40 years of age who are hospitalized. So those that we categorize it as 40 and under. So very concerning.
Yeah, and of course, I think as Penny mentioned, a lot of this is a reflection to the age groups that have had the eligibility for vaccinations and are getting vaccinated. And as we get now, we're in the second week of 16 and over. This will certainly help influence this younger age infection numbers. Okay, well, I think that's all of our questions for today. We have reached our, in fact, it's 5 minutes over our normal time, but I want to thank everybody for joining us today and remind you that, wow, we've been at this for almost a year now, and it's an important way for the people on this call to answer questions and make sure the public knows everything we do about what's going on in the COVID fight. So we'll be back again next Friday at 1:15 to continue with updates and discussion, and we look forward to you joining us then. Thank you very much and have a good weekend.
Thanks,
Bye-bye.
Kirk.
Thank you.
Well,